More doctors are doing it, providing more personalized care, even making house calls. Doctors who say America's health insurance system is a nightmare are turning to concierge medicine. Thanks for joining us. I'm Sam Shane.
And I'm Adrienne Moore. But there is an added cost, so we wanted to know tonight, is it worth it? CBS 13's Kelly Ryan is live in the newsroom tonight getting answers. Kelly?
Imagine having your doctor's personal cell phone number and being able to see him or her on short-term notice, even a home visit. Insurance companies won't pay for it, but more and more customers are willing to.
A fantastic doctor treats the patient and prevents the disease.
It's like hitting the mother lode when you get an appointment with Dr. Tepper. He's very busy.
Janeece Sargis says trying to get in to see her doctor can sometimes take a month, but that won't be the case much longer. Sargis isn't changing physicians. Dr. Tepper is changing his practice.
Medicine is about taking care of people.
Dr. Tepper is one of an increasing number of doctors moving into concierge medicine.
Medicine happens when we're face to face.
A concierge doctor takes fewer patients, and those patients get more personalized care. Same-day appointments, the doctor's personal cell phone.
I'll be able to do more house calls. Patients will have more access.
Access, he says, is limited by time spent filling out insurance forms.
There's a study that Hopkins did that looked at it and said that the average primary care is spending 28% of their time face to face with patients.
That's 72% of a doctor's time spent on paperwork.
It's kind of sad to think that all of that education and experience is going to filling out reports and forms.
Insurance companies won't pay for concierge doctors, and patients still need a health insurance plan for surgeries and other medical needs. Some call it medicine for the rich.
I didn't go into medicine just to be a physician for wealthy people.
Dr. Tepper will give discounts, and some of his longtime patients who he knows can't afford it will not be charged. Special Docs Consultants, a company that helps doctors transition to concierge medicine, says fees range from $1,500 a year to $5,000, with an average cost of around $2,200. Dr. Tepper says his patients deserve more of his time than his laptop.
The computer is not sick. If I wanted to treat computers, I would have gotten a degree in computer science.
Now, Dr. Tepper says a typical exam for patients these days is about 10 minutes long, not enough time to give a patient a full accounting of their health.
Oh boy, Kelly, we are hearing more and more of this happening with so many doctors. Does Dr. Tepper actually have any hope for a future of this kind of medical care for everyone?
Yeah, believe it or not, he says that the high cost of medicine lies in specialists and costly pharmaceutical drugs. He says it would just be much cheaper overall to have doctors spend more time with patients and preventive care rather than a short visit and sending them off with a pill.
And then having them fill out paperwork for half the day.
Exactly.
Okay. Thanks a lot. Very interesting report.